Hello, hi guys, this is Lisa, and I'm starting today the live. Like I was saying, and I say every Wednesday at 7:30, we connect to talk a little bit about different topics. So, for those who doesn't know me, I am Lisa, an occupational therapist, specialized in Padawan therapy, and basically I work with children with different ages and different difficulties. So we work at Panacea Therapy Center, and I work with children, like I said before, with different difficulties and different, challenges as well. So today I'm going to talk a little bit about the Nemechek Protocol. I have it here because it happens that this week, I don't know, maybe it's a coincidence or not, but I had a lot of parents, not just this week, but even last week. I had a lot of parents who was asking me, they were asking me about picky eaters, about feeding difficulties, children who have really restricted diet. So I'm talking about those kids, right? And I always try to give my point of view and obviously see what we can do during therapy session, see how we can help, see how what can be done. Now, every child, independently autism or not autism, every child is different. Unfortunately, there is no one methodology that we can be working on feeding, or especially children who are very picky eater. And not just picky eater, but maybe they have other medical conditions that we don't know about them. And I like to suggest different options for parents, so they feel like they have an option. Because sometimes it's maybe even when they speak with the doctors and everything, it looks like there is only one option or at all. So therapy, obviously, it's one of the options, and it's a very good option. But sometimes therapy has also a limit. You see, we all have limits where we can arrive and we say, okay, so that's it. Maybe we can help more, maybe we can help less, but there is always a limit. Today I would like to talk about Nemechek Protocol. For those who know about it, please join me and write your maybe I don't know, your comments or your ideas and also your experiences with it. For those who don't know about Nemechek Protocol, I'm going just to talk a little bit, not in profound, because I'm still studying it and I'm still like reading about it and checking about it. So this is something that I want to do, but I would like to share with you a couple of stories that I found them fascinating, to read. And because many times I am going to be facing, for example, with some stories that I read, I felt very much like, oh, this could be my client. This could be, the parents who has this kid that is very similar, like in the book. So the idea, hi to everybody, I'm an occupational therapist, and my topics today is going to be about occupational therapy, not only, but children development, especially autism. Okay, so I am a therapist and I work with children with special needs. Thank you. And like I said before, we recently in these past days, I had a lot of parents who came with difficulties in feeding, difficulties in tolerating different food, very oppositional behavior during meal times, and okay. So I would like to introduce, if you don't know Nemechek Protocol, I invite you to read about it. I invite you to check about it. I invite you to read the book. It's accessible. You can buy it anywhere, and it's really nice. It's for ADHD. It's for autism, children who, in general, who suffer from developmental delay, which is, we can say, the majority of kids with special needs. They will always have certain difficulties in certain areas. And I really find it interesting, especially for the food. Not only for the food, for behavior, etc. Why do you do this for help? Uh, uh, I do this to help others. You mean my job? My job as an occupational therapist, I work with children with special needs. So I help them to talk, read, walk, be independent, etc. I am a therapist. That's okay. Um, the live. This is weird. Why it's weird? Yes, no. I do the lives. So, well, this is for more for my followers in YouTube channel. So, if you're not a follower, you can subscribe. Basically, I try to offer because I have followers from different countries around the world, and it's not very easy for me to no answer to everybody at the same time, and at the same time there are a lot of different topics that I think many people could benefit from. So every Wednesday at 7:30 I go live, so I could answer your some questions, and maybe if you have like a struggle or a difficulty, maybe I could help you, your kids, if you're a therapist, if you're educators, etc. Well, you cannot contribute because, well, unless if you're a therapist, that's great. That will be amazing. If you're an educator, if you're anyone who is around the healthcare, I will say system, can always help, can always educate themselves, and you can always get better. Well, thank you very much. You're fine and a nice helper. We need more people like you. You have a lot of people around the world, okay, like me. It just not everybody maybe has the patience for it or maybe the time for it. But this is a little bit the project, for me to connect, to talk with you, and just be able to. If there is one person who benefits from it, good. I'm happy. Medical student, okay, Tanish. So if you're a medical student, that's great. You can definitely benefit from these lives. This is not my first time. There are a lot of lives going on in the YouTube channel. You can check them if you are interested. And obviously, if you have any questions, you can ask me. And if I can, I will be glad to help you. I would like to come back to Tanish. You cannot read. What do you mean? You don't read English? So this live is about Nemechek Protocol. Is basically it's a protocol for children with autism and developmental disorders. And I have the idea, it was to talk a little bit about different cases that they are described here and to share with you my opinion about it, and also to see if someone with you agree with me and so on. Because lately I've been having a lot of children who suffer from picky eaters, very selective with food, very oppositional behavior, so difficulties in feeding time. And many times we tend to say that this is because of autism. My child is not eating fruits and vegetables because he is autistic. And many times you have other reasons. Perhaps the diet that was introduced, maybe the surroundings, maybe the vitamins that the kid is getting, or whatever, can also be responsible somehow of this rigidness during eating or the behavior outcomes. Because most of the time we have children with behavior difficulties, and you say like, okay, so I will go for ABA, and we will be talking about, and we will be working with behavior. That's a good start. But not all parents have the accessibility to go to ABA. Not all parents has the possibility to go for therapy in general. So sometimes there are other things that could help. And I personally, I like to see the possibilities to help parents, with giving different recommendations. And I had some parents who recommend me to check the Nemechek protocol. Honestly, with you, I bought it long time ago and I went through it a couple of times, but I never managed to go through it entirely because there is always something else to do. I am a full-time therapist, with my private clinic, so obviously there is a lot of things going on, but I definitely recommend this book for parents who struggle with feeding, parents who struggle with children with behavior, children with eczema, children with difficulties in attention, or children with other type of disorders that you can see that they are maybe experimenting different behavior issues, no eye contact, or attention difficulties, etc. Now, when I describe all of this, you say, well, yes, that's autism. Okay, most of the things it comes because this is the way how we describe autism. But I am not very fond of labeling children, just because of their autism. Like I said, sometimes it's true that certain things comes because of autism, but you have to really know what means autism, and how to identify that this is causing really because of autism and not because maybe of a medical condition that the child is having, or maybe the diet that the child is having, or maybe the type of food that the child is eating. Because nowadays we have a lot of kids who are in a high sugar diet, with a lot of stuff, and then they say like, oh my goodness, my child is hyperactive, or his ADHD, it's in no way in control. We try different medications and nothing is happening. Well, maybe we have to look other things, no? Now, I am not here to judge nobody. Everybody can do how they can and what they can. But it's very important that if you are having a child with ADHD, if you have a child with autism, if you have a child with developmental disorder in general, it's very important to work with a nutritionist who can guide you a little bit what should be the intake and which diet you should have. And then also there is something like the Nemechek Protocol. Again, this is not paid advertisement. Nobody paid for me to advertise this book. I just would like to share the cases that are described here, and I really identify my experience as a professional with some of these cases, because I work with children who suffer from seizures, or children, like I said before, who will be with behavior quite advanced and severe. So it's not always easy to manage, and there is not always a perfect reasoning why this behavior is happening. Do you think autism could be environmental or acquired? I will say, like a good professional, you should say both, but I think it's a tricky question. Yes, it could be both, but I will say that, especially reading after the Nemechek Protocol, I don't think it's happening out of nowhere, it's difficult to explain. Sometimes it could be the way how the environment of the kid is producing and provoking certain behaviors that could cause, but autism is quite of a spectrum, no? And requires a couple of characteristics to fit in for you to be diagnosed with autism. So to get everything from the environment, I find it difficult. There is for sure something in the genetics, or otherwise perhaps the diet, the food, the intake, maybe some medical issues, or our autonomous system and nervous system is not functioning properly, that is pushing certain behaviors, certain sensory needs to be more present than in other children. It's the same like the thing of the vaccination. They will tell you, do you believe that the vaccine is causing or not causing? I think it's a very difficult question, because every child is completely different and everybody is different. So you cannot just put everybody in the same packet. Yes, vaccine cause this or not, or if I eat too much fat acids, this is what will happen, or this not. I think it's always about individualized approach. See what works for you, how your body works, and first of all, and very important to understand how we work. What is good for me, if I do have allergies, if I don't have allergies, if I am I don't know if I should be in a gluten-free diet or not gluten-free diet, whatever, But many times we are inputting things in our kids from the babies, and then we are not understanding why the child is not manageable, why the child is, all over the place, why the child is not eating certain things, or when he's eating, we are afraid to give food, or we are afraid to give stuff because we are waiting for the child to be 7 months old because the pediatrician said so, like we have a lot of things going on. And I feel like nowadays there are, because due to social media, so many things are accessible that few things are done. Before we were more restricted because there were like few things that you could do, and now you can do really a lot, but still we cannot manage. So it's obviously have access to also many things brings you more confusion, and sometimes you might take decisions that are not correct. So I would like to read, like I said, the Nemechek Protocol. It's basically it's a simple treatment. It's a book of a doctor who is, basically he is an expert in autism, and children with developmental disorders. And because of his observations, because of his experiences, and etc., he created this protocol, which he applies different. He creates diets. With food and different supplements, natural supplements, and he believes that certain supplements works better for certain skills, to control better the behavior, the attention, seizures, etc. To read it better and to understand it better, it's better to read it full. It's quite easy to read, so you don't need to be a therapist or or a doctor or so on. But I would like to share with you. The 3 stories that are really, really, I find them. I already identify a couple of clients of mine that could benefit, and I could actually see them like that, So I once read that they have a structural brain abnormality, something in the mirror neurons, something related to the arrangement of the neurons. Yes, could be. To be honest, whenever I had a child, because I always suggest to do the MRI. MRI, it's done most of the time when there is a brain damages, but I always suggest to do the EEG, electroencephalogram, which is completely safe, and you don't have any side effects out of it, and most of the time the results are clean in children with autism. So you hardly, never you see any extra movements or so on. Maybe you can have some areas where you have overstimulation of activity or less, but most of the time it will be okay, even the MRI. So I don't know, that is something that I will say, I never experienced it, because most of the time children with autism, especially when they are diagnosticated at the age of 2, 2.5, 3, they had a normal birth, they had a normal development, they were eating everything up to 2 years old, they were doing their milestones, they started to bubble, they started to walk, talk, blah, blah, blah. And then suddenly there is a cut. So neurologically, the child is developing good. Everything is okay and the structure is there. So what happened? What was the cause for the autism, not to appear at that age. And I strongly believe that in certain cases, not for all the cases, but in certain cases is because we want to see that the child is developing, because for the age of the kid, certain skills are very basic. So if the child is expected to walk by the age of 1 year and 2 months, top, if the child starts walking, we are like, okay, so that's it, this is done. The way how he walks or not, well, that's, you need to be a little bit of a, more expert, but otherwise the child is walking. If the child needs to say certain words and he starts to babble, the child is talking. But really and truly, how the child is talking? Are we really perceiving the intonation of the voice? Is the child communicating non-verbally and verbally? Do we have present certain sign language, or certain expressions in the face? That's a little bit difficult. And most of the time, I believe that for parents, it's a difficult question because not everybody is know about autism, and not everyone is like I said, educated in that. So it's totally normal. Certain questions and certain observations are not coming naturally because you need to have that extra knowledge for you to observe. What type of food do you suggest to introduce or avoid to help ASD? So this is what I'm saying. For example, I definitely read this book. Very good. You should definitely, for everybody, definitely this is a book of that if you think to buy a book because you don't know what to read, please. So it's really nice, really good. Which type of food? Well, I think the best will be to follow the protocol, but if not, I guess you need to get omega-3 supplement, different type of vitamins to make sure that the kid is getting everything, depends on the food that he is eating, and try to avoid sugar, obviously everything that has to be sugary we have to avoid because it doesn't help the diet and doesn't help the stimulation, let's say like that, of the nervous system, because sometimes we overstimulate and then it's like a difficulty. You have to understand that autism in general depends on the type of autism, but most of the time we have a lot of sensory difficulties. So sugary diet, let's say muffins, different cupcakes, chocolate, Coca-Cola, maybe juices, but not natural juices, but juices already like that you can buy. Those are having so many different things inside that when you have a child with autism, with sensory needs, when you boost something like that, it's even worse, because we become even more, we look like more alert and the kid is extra happy, but that is just a short period of time because of the food that he's eating. It's important to do blood tests, important to check allergies, important to understand if your child is not suffering from any medical conditions that you are not maybe seeing. And this is the reason why the protocol, I like it a lot, because it goes quite deep. It's very simple, but it goes quite deep in your health. So it's not like you're giving your child a particular medication for him to get rid of autism. No, it is you are getting better the diet of your kid to make sure that stabilize certain nutrients, so he will have a healthy gut, he will have a healthy intestine, etc., etc. No. So I think the best it will be a controlled food, in a good intake of vegetables, fruits, and stuff. Yes. So, one thing more about the food that I wanted to do before to answer your question, also the amount of intake of milk, because this is another thing that I struggle in my experiences. We have a lot of children who are still with the bottle at the age of 4 and 5. Don't take me wrong, to take milk, there is nothing wrong with that, but we shouldn't be taking 2-3 bottles a day of milk at that age. And then obviously we complain that the kid has a limited diet, for sure. Can you drink for yourself? I mean, not for yourself, because at my age it wouldn't make much sense, but even me, if I drink 3 full bottles, of milk, and after that I have a snack, and I have, I don't know, a portion of something, definitely I'm going to start becoming picky, or I'm going to start becoming choosy, because I don't feel like maybe to eat so much, and at the end of the end, remaining with the dummy, remaining with the bottle, remaining with this milk, warm milk and stuff, we are just going around the same babyish cycle. We are not maturing our kids, we're not letting it grow. At the age of 6 months, approximately 4 to 6 months, when the first tooth come up, we have to switch to food. How many parents do that? It's very difficult, and there is always like different circumstances. Obviously, everybody has their own life, etc., but it's very important to take care of what we are eating. Very important. And especially, when we are going for therapy to help children to eat, we have to have to be the how to say, the example. We cannot be pretending that our kid will start eating healthy if we're not eating healthy around him. So if we are buying chicken nuggets, it's because I go to the supermarket and I buy the chicken nuggets. The child doesn't have, at the age of 2 years old, will not go and say, let me go and buy chicken nuggets. So we have to be very, very, very aware about our choices, about our introduction of the food, and how exactly we introduce the food and when, and etc., etc. So this is extremely important. So, neurology crash, I am really sorry for my frequent questions. Not at all, I enjoy it. Could you tell us stories from your clinical experience? Of course, I'm going to read the story that I selected from the book, but I would like also to tell you one particular story. For example, with feeding, actually I will tell first my story and then I will read it from the book. I have different stories with feeding. Okay, we had children who came with a peg, okay, or children who was eating from the nasal tube. Because of their difficulties when they were born and so on. And we started working on different oral motor skills in order to get better and the tolerance of the food through the mouth, no? Because the child was getting the food through the nose or through the back. So directly, basically on their tummy, so the food was going directly. So the mouth was not working at all. Normally, our food, the intake of the food is through the mouth. That's all. There is no other way, okay? When we are having difficulties, and obviously there is a situation where the doctors recommend you to do the operation and so on, and to change and to start having such solutions, obviously we have to adapt. But I always say that we have to continue working with the mouth. And for example, we had a couple of cases where we managed to completely remove the nasal tube and the child is eating through the mouth, everything. So that's, for example, it's very good. We had a kid who was 10 years old. For 5 years or 6 years, he was eating through the bag. And then after 1 year, 2 years of working with us, he started to tolerate some pizza, he started to tolerate some sandwiches, and then they removed completely, and now he's eating through the mouth. Then we had, for example, another girl. She started when she came. She had the nasal tube, and they were reinforcing to put the peg. And after 3-4 months of working, we managed to stabilize her, and she's eating through the mouth. Obviously, in this case, we are not expecting the child to be super mega, active, but she's eating through the mouth, which is the best outcome that we can have. We had children that, for example, lately there is a girl, she's 6 years old, she's moderate autism, verbal. She has limited diet. She eats bread with cheese, sometimes spread cheese. She will eat a sponge, it depends, biscuit. She can eat chicken nuggets and fries, but the fries has to be from a particular place, like McDonald's. So homemade fries she will not accept. And she eats the bread she eats only at school. She will not eat it at home or in the clinic. This is when we started it. The yogurt she used to eat, and then she stopped. And there were a couple of things, other fruits and vegetables that before she used to eat, and now nothing. So basically bread and cheese, and this is just at home. At the school, and then she will have like bread alone at home, and maybe a biscuit or two, and then chicken nuggets and fries in places. And now we manage that she eats at the clinic bread with cheese always. It's a sandwich. We manage her to eat chicken nuggets on her own without, not only at home. So she can eat also in the clinic and at home. She's eating a yogurt on her own. She's eating fries as well at the clinic, not only in McDonald's. So you will tell me it's not very healthy food. Well, we have to go from what we have. So if I meet a girl who is 6 years old and all her life she ate that, I cannot come and change completely, right? What I can do is to say, okay, she was eating this and that. Now she stopped completely and she's eating 3 things. What can we do to restart the food that she already ate? Because you have to understand that once the child accepts the food for the first 2-3 years of life, there is something that triggered for him or her to stop that food. Most of the time, in my opinion, it's environmental. So maybe the environment is changing at home, maybe it's the behavior towards the food, maybe it's the flexibility of the parents, maybe the child feels more under control. Today I can be more choosy, tomorrow no, etc. And the kids are very, 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 very professional in feeling if I have a limit or not. So if you don't put a limit from the beginning, unfortunately you lost it. So there are a lot of different aspects that if I wasn't there with her from the beginning, I wouldn't know. So I always say, like, it's better to work on the food that she already accepted, and we start with this food, even if it's not amazing food, because eat bread all the day, you have to understand that it's not acceptable. But if she started accepting sandwiches, for example, next week I want to try a sandwich with she actually tolerated sandwich with cheese and just cheese and ham as well. I want to try tomato paste with bread and then tuna with bread, So slowly we are going to start introducing new things. But definitely we cannot come just from the beginning and say, yeah, let's go and eat chicken with broccoli. She used to take orange juice and then she stopped, and now we start giving her again orange juice. Slowly, slowly. Feeding, it's very difficult. I have a lot of stories, but to be honest now, if I think about it, we had a really pretty incredible stories, but I will not be able to recall now everything because I've been working for many years now. So for sure there are more. I have kids physically, but that's more physically, stories that's maybe not really for now. But in feeding, for example, there is this case. If you're following me on social media, thank you for your support, Panacea Therapy Center on Instagram. You will see that sometimes I post some picture of a boy who is eating like big plates. For example, in this case, it's a child with autism, and he up to the age of 6.5, 7, he wasn't eating at all. He was only eating puree. So his parents were always liquidizing everything. They will be going abroad, they will be coming back, etc., and they will be liquidizing the food. So there were no way how he was chewing, how he was tolerating, nothing. So he was just eating puree. So a lot of soups, a lot of puree, a lot of yogurt, things like that. And even like yogurt, no pieces inside of the yogurt, just plain yogurt, etc. And now we manage actually that he eats everything. In 1 year time, 1 year it took me, I will say even a little bit less. Now he's eating pizzas, he's eating pasta, he's eating pasta with egg, pasta with tuna, pasta, baked rice, sandwiches, he's tolerating vegetables, omelets, anything. So the parents don't have to liquidize anything. He's chewing the meat, he's chewing the turkey, he's chewing the chicken, anything. Like the parents, tomatoes, cucumbers, anything. What we are struggling still, it's a little bit fruit that are a little bit more wet, like watermelon, melon, maybe peaches, but even that improved. So, like I'm saying, there is no always like magic, okay? But sometimes really good stuff happens. And like I tell you, with this kid, it's a very good example because we came like from liquidized food. I remember now the first time that I introduced him the sandwich. It was a disaster inside of the therapeutic room, But once I provide him that security that you can do it, you can chew, we have to show you how to chew, how to use the teeth. Once he started biting and start chewing and start feeling comfortable, etc., and now he's managing any type of food. It's incredible, In fact, the parents, this is the first year that they went on a holiday without bringing the food with them, without liquidizing the food, without, thinking about the luggage that I have to take with all the food inside because my kid, I don't know what I'm going to give him. So actually, this is a very nice example, So, and I have more like him, but not. I will say the difficulty with autism is that mainly with autism, because this is my cases, no, that every child is different. So you cannot say like, this kid, I think he's not going to eat, this one, yes, because you don't know. You will have to identify what is actually the problem. And for some children, my methodology or my behavior in the therapy room, it's good. And for others, it's not, because, well, I am well known to be disciplined. So it's a good thing, and maybe not, whatever, but I'm well known to be strict in my therapy session. So what I mean, it's like we don't play with the food, right? The food is to eat. And one thing is the sensory need and the playtime and sensory play, and another thing is actually we are feeding, we're eating, it's food, we provide on the plate and we have to eat it. So yeah, I will say that I wish to share more. My memory, though, is not very amazing. I'm going to read one of the cases. There are 3 cases in the book. I can easily identify my clients with the 3 cases, okay? But I would like to do the 2 ones that maybe for you, or even for just even to give you my opinion, and maybe the case that I already explained before, that could be in which way I could work, on which way this is really interesting or not. So I'm going to read the cases of the Nemechek Protocol, okay? This is the book that I was talking about for quite now today. And basically, it's a 7-year-old boy with developmental delay and oppositional defiance disorder. Okay, so we have some oppositional behavior and developmental delay. This 7-year-old boy was brought to see me because behavior and focus problems had deteriorated so much that his elementary school was trying to prevent him from entering 3rd grade. So obviously it's talking in the first place because this is the doctor who wrote the book, okay? So basically the doctor is saying this boy came to see me because his behavior issues and attention was really deteriorating through the time. He was having substantial trouble with focusing, he was easily distracted, he was excessively talkative, and he was very argumentative, okay? He had eczema, experienced frequent abdominal pain, would have random fevers, and he was a very picky eater. For example, in many picky eaters, random fevers are very typical as well. I will have a lot of children who will have fever for a day or half of a day, and the next day as if nothing happened. And this is not the first time that I hear it, and I have really a lot of cases where like, like 2 days ago he was like having fever, but he woke up in the morning good. And sometimes you have to be questioning the reason why, like not always is because, maybe he was getting sick, but finally he is not. We don't have fever just to have fever. Our body is very intelligent for that reason, you know. We get fever because there is a response to something, right? He was started on inulin and omega-3 fatty acids from fish oil. And after only 10 days, his mother reported his eczema was dramatically improved and he was beginning to calm down. So after basically 10 days of treatment. So the Nemechek Protocol, she applied the Nemechek Protocol. The doctor suggests her inulin and omega-3 fatty acid, and the boy started improving his eczema. After 6 weeks, his school performance and behavior had shown significant improvement. He was still struggling with some social interaction skills at this point. So basically, first, thanks to this protocol maybe change in the diet, he removed the eczema, and then after 6 weeks on this protocol, his school performance and behavior had shown some significant improvement. No? After 5 months, behavior problems were no longer being reported by the school, and the improvements in his academic performance ranked his near the top of his class. After 3 years, he continues to do well as long as he continues on his inulin and fish oil supplements. Like I'm saying, what I like of this protocol, it is nothing against, it's not medication. Basically, they put you on a supplement that it's healthy for your own health, you know. It's like the same like you will be taking vitamins D on a daily basis, you know, or fish oil on a daily basis. They say that it's good for the brain, no, for concentration, for attention, etc. So this is the same. So for example, this is a real case that it's a story of recovery. So the parent came with this issue, and after 3 years, there is no issue. As soon as he continued taking, obviously, these supplements, because apparently his body needed these supplements. Another case that I would like to read for you, it's this. 5-year-old girl with non-verbal autism, which, for example, I can already relate a couple. The first story, to be honest, is just interesting because we don't have usually clients who comes because of eczema, and I don't have clients who suffer from eczema, really few. With fever, like I said before, yes, but I will never have a kid who will come just because of suddenly behavior issues and suddenly problems in attention. They have to come for a long time now, you know, it's not like just coming and going. So I cannot relate too much to this case. But it can still be very helpful, no? A 5-year-old girl with non-verbal autism. This 5-year-old girl had an uncomplicated birth, but the mother felt her daughter had subtle behavior issues from the very start. So basically the birth was okay, but the mother felt that the child is having behavior issues. She was showing substantial delay by 6 months of age. By this time, she already had received several courses of antibiotics for ear infections. For example, ear infections are also very frequent in children with autism. After taking the antibiotics, she developed severe eczema over her hands and face. And this, according to this doctor, it's a sign of intestinal bacteria imbalance. So this is why I like it. You know, he explains quite a lot, like, okay, so if you're having eczema here and there, because maybe you're having an imbalance in your intestinal, so you have to check it out, you know. At 9 months of age, she underwent cleft palate repair, which resulted in a marked decrease in her overall functioning. She also developed acid reflux and esophagitis. So basically, she had underwent cleft palate repair, so over here, and then she had decreased her overall functioning, I can imagine, because a lot of children as well, after certain operations, develop different difficulties. By the age 5, okay, so she's now 5 years old, she was having multiple problems and always seemed hungry and grumpy. She did not smile. So basically smiling was an issue, and she was always seemed hungry and grumpy. After 6 weeks on only being treated on inulin, she tolerated the transitioning back to school without her usual emotional meltdown that had often accompanied changes in her routine. The eczema on her skin had improved, but she still had increased level of hunger. Fish oil was then added to her regimen, and over the following 4 months, her emotionally and learning skills greatly improved. Her eczema had disappeared, and her hunger seemed to be reduced to a normal level. So I guess that here, because he added fish oil, he saw changes on the eczema and at the same time on her appetite. She was beginning to speak clearly, and she seemed to be picking up a few new words every week, which this is amazing, because if you meet a girl of 5 years old and she's nonverbal and then she starts to talk, I don't know, I don't have much to say about that. After 1 year of therapy, she was academically and emotionally functional normally for her age. She still had occasional speech issues, but for the most part, she was fully conversational. 3 years later, my wife and I bumped into this family at a local hardware store. She was running around and playing with her siblings. Her mother said her daughter was totally fine and she was not having any issues that anyone could detect. And we saw her smile. This is like super nice, you know, because like when you meet the kid, you know, like she's hungry, she's grumpy, she's not smiling, everything it's like a no, no, no. And then suddenly you see her talking and smiling and everything. For sure, there is a big change, no? And such a nice feeling to see. For example, a girl like that, I can relate to with some girls that I already worked. Girls are different than boys with autism, and you can see a lot, I would say, the difference between. So it's interesting, and you will tell me like what he did. Basically, he put her in inulin and he put her in fish oil, I believe, because he doesn't mention anything else. So I don't know, doesn't look like crazy. I think everyone has access to that, right? So I think it makes sense to sometimes to give a try different things, maybe more natural, and see if maybe something else it's affecting the autism. You know, nobody's saying that the autism disappeared. For sure, this girl still is having autism. She has, once you have the autism, it's not like something that you can say, okay, that's it. But if her life from being non-verbal to verbal and completely stable, without eczema, without smiling and enjoying life, what else you can ask for? And this one, honestly, just touched a little bit, made me think, because I have a girl right now who could benefit a lot, and I didn't read this story before, so I would like to share it with you. Sorry, Azad Hussein, is any music can out children from autism? You mean if there is any music that can help autism? Well, the music that I like to use, it's baby Einstein music or baby Mozart music. It's helping a lot to develop certain calming strategies, I will say. It looks like works a lot, but I will say that the best that you can do is provide to your kids certain YouTube videos where you can work on speech and musical development. For example, there is this one, Miss Rachel. She is very famous now in YouTube. She does a great job, and she, you know, like work a lot of in non-verbal communication and verbal communication, etc. She's extremely good, and you learn there a lot of different skills, but at the same time you have music as well. But if it's purely music, Einstein baby Einstein music or baby Mozart music, It's perfect. You have even in YouTube, if you put baby Einstein music, you have already like a setup for 1 hour just to put it there. If you're cooking or the child is playing in the background of the house and you don't have to do it yourself. I will switch off the light because it's becoming darker and darker. I'm going to finish the story and I leave you in peace, I promise. I think like that is better. Yes, because it was too dark. So this is a 23-year-old nonverbal autistic female with Lennox-Gastaut syndrome. Okay, maybe I didn't pronounce something wrong, good. Sorry. I have seen this amazing potential for recovery in the adult autistic brain if provided the time necessary to heal, as well as a consistent, persistent effort in maintaining. The Nemechek Protocol. I have mentioned this patient several times already, but a more detailed explanation of her continuous strides, all previously thought to be impossible to achieve, have given Jen and I great hope for all the other autistic children out there. I first met her, a 23-year-old non-verbal autistic female with Lennox-Gastaut syndrome, in 2015. This is a type of epilepsy with stiff or drop-type seizures. So this is basically, it's a child, not a child, a woman, non-verbal autistic who is having epilepsies. There were minor complications that required her to be in the NICU for several days after her birth. By the age of 10 months of age, she had begun having infantile spasms. So she started having spasms at the age of 10 months old. She never really learned to speak except a few words here and there, and developmentally her mother said things just seemed to worse after the age of 4. She was virtually unable to communicate. When I first met her, so this doctor, she was having 6 to 8 seizures per day, in spite of being on multiple medications to stop the seizures. This is very frequent as well. We also have a lot of clients who has a lot of medications to stop the seizures, but the seizures don't stop. And you still get a lot of seizures. So when he met her, she was having 6 to 8 seizures per day. Okay? Due to the frequency and violent severity of these seizures, her parents could never leave her unattended in a room by herself, obviously because it's dangerous. She had ultimately given the diagnosis of Lennox-Gastaut syndrome. At the age of 23 years old, she had never held her parents' gaze, so she never looked at her parents. She did not like to be held, she could not color or write, and she sat curly up in a chair mostly of the day rocking. Her speech was limited to occasionally saying the name Michael, which her parents believed to be an imaginary friend. I initiated my protocol of rifaximin for 10 days, high dose of omega-3 fatty acids, and I had her mother start cooking with California extra virgin olive oil. For example, these doctors talk a lot about California extra virgin olive oil. He doesn't say, he completely forbids to cook with sunflower oil or any other oil, but the California extra virgin olive oil, it's okay. Within 8 weeks, her seizures had dropped from 6 to 8 per day down to 1 or 2 per day. So, just by applying some omega-3, high dose of omega-3 fatty acids and California extra virgin olive oil with the food that she was allowed to eat, her seizures already dropped from 8 to 10 and they dropped down to 1 or 2 per day, which is fantastic. The drop in her seizure was so significant, her parents were able to start leaving her in a room by herself for short periods of time without fear that she would have a seizure that might hurt her. She would now sit upright in a chair, and for the first time she slept through the night, because apparently she was also having difficulties to sleep during the night. After 4 months of treatment, she started looking at her parents in the eyes. So this is a very good indication as well. Imagine you spent 23 years without looking to the eyes of your parents, and after 4 months, you start having such improvement. She began touching their cheeks and lips as if she was seeing them for the first time. She also wanted to be held, touched, and hugged as well. After 6 months of his visit, she started to smile at me, and her seizures had reduced to 1 or 2 per week. So we start 6 to 8 per day and 1 to 2 per week. We discovered she could now write her first name and last initial, although she had never ever been taught to write. And she could draw objects that were recognizable. After 8 months, she began speaking Spanish and English, but emotionally she was behaving still as she was a 3-year-old girl. So they were having some tantrums. This was a difficult period for her parents because she was a grown-up woman who grabbed items off the shelves, then would lay on the floor and start crying. And obviously this is not socially acceptable, right? You don't see a 23-year-old woman laying down on the floor throwing a tantrum because you want a biscuit. To get through it, her parents just started buying those items and returning them to the store at a later time, which is not bad. It's kind of you allow the child to buy it and then you return it. At her 18th of his visit, so 18 months after, she could speak very clearly in full sentence, and her seizures had declined to 1 or 2 per month. This is brutal. Having 6 to 8 per day, and after 18 months, to have 1 or 2 per month. She spent a large part of her day playing dress up with clothes and shoes, and her mother said that she matured emotionally also up to the age of 5-6-year-old kid. So obviously she wasn't behaving still as a 23, but at least at the age of 5-6, which is not bad after 18 months of treatment. At her 27th month, she continues on her high dose of omega-3 fatty acid from fish oil, and her mother is still cooking with olive oil. So, and I guess that this is a case going on. This is not like, that's it, you know. So after 27 months, she did a significant improvement, obviously, and she continued on omega-3 fatty acids. In fact, if you check on your own omega-3 fatty acids, the benefits, everybody will tell you that they are very good, that it's very recommendable to have them in your diet. So I don't know. These are the stories that I wanted to share with you. Today was a little bit intensive, and instead we stay 1 hour. What? That's too much talking. Guys, I recommend you this book if you have some free time. If you would like to learn more about autism, the diet, omega-3, and all of this, check it out. You can check Facebook also to read about what he's publishing, the researches and so on, even the comments of the people. It's very interesting. Nobody's saying that the autism is going to be cured. Nobody's saying that this is the how to tell you, the cure, no? But it's a hope. And the funny things that I already sent a couple of parents with this protocol because a parent recommended, you know. So yeah, I am very happy that there is something like that. I'm happy that there are doctors and people who are trying to help and trying to understand autism and in general how our body works. Now we have to do our best to continue pushing this through. Okay, so thank you very much for staying with me. I'm going to see you next Wednesday at 7:30. I connect every Wednesday, and every Wednesday is a different topic. One more time, thank you for staying. For everyone who came and left and said, oh, this is too boring. I hope it wasn't too boring. I hope you enjoyed it, and I will much appreciate for your subscribe. If you basically, if you're new, make sure to subscribe, for your support. That's what I wanted to say, for your support. not just to YouTube channel, also on Instagram, my personal Instagram or Panacea Therapy Center. Maybe you see some videos that are interesting for you, and maybe somehow it can give you some ideas as well. So that's just up to you. If you have any questions or you would like to share any of your stories, please do so. I'm always happy to read you, to hear from you. Okay, I will be seeing you next Wednesday. Thank you very much. Have a lovely day and the rest of the week. Bye.